Good Friday morning, everyone, and thank you for tuning in to yet another weekly Friday edition of the Alan Fitz podcast, also known as The Chat. Alan Fitz, your host for the program this morning, and welcome into the show. Folks, we're going to get right into this podcast this morning. We're on location at Yellow City Grind, located at 4410 Bell Street here in Amarillo, just to the north of the Bell 45th intersection. And I have a guest on the program with me this morning. He has got a few interesting stories to tell. His name is Dr. Matthew Turney, who is a board certified emergency room physician at Northwest Texas Hospital here in Amarillo. Good morning, doctor.
Good morning.
How are you?
I'm doing very well. Thank you.
Good deal. All right. As I was telling him before we came on the podcast, I forgot the list. Normally, if I have a guest on the show, I'll have a list of questions before them, but got in a rush to get up here. So I'm just going to fire them off the top of my head to you. Tell us a little bit about you, where you're from, where you graduated high school, and how in the world did you decide to become a medical doctor?
Well, thank you for having me. I was born and raised in California, Northern California. My father was a surgeon, and so we kind of followed his um, the way his travels throughout the United States while he was going to school. We went to St. Louis, Missouri, where he went to medical school, and then came back to California, and that's where he practiced, was in Northern California, up in the Sacramento area. Uh, Watched him do what he did, and it kind of caused me to want to be just like him. So we had a little ranch in Northern California that we raised cattle and sheep and pigs and horses, and uh, worked on the farm for a while, and while he was working in the hospital. And so we did that for quite a few years, and then went to high school initially at Placer High School, which was in Auburn, California. And then we moved after my freshman year, we moved down to Roseville, California, and I went to high school at Oakmont High School in Roseville, and I graduated from there. Then decided I wanted to go into medicine. So that's what I did, is head over to, initially came to actually here in Abilene Christian University, and did my first year there. And then I think I probably got pretty homesick, so I headed back and finished off in CSU Sacramento. Got kind of tired of school. It's a lot of school. So I had to reevaluate my life, and decided I was going to become a nurse instead, with less schooling. So I went ahead and entered into the nursing program at CSU Sacramento. That's where I met my wife, Linda, and
Was she also a nurse?
Yes, she worked as a pediatric nurse at UC Davis Medical Center, and that's where I went to eventually work, was at the surgical ICU at UC Davis Medical Center. Then what happened was I watched all the residents and interns running around and got the bug to get back into school. So 2 years later, I decided to go back to working on my classes to get into medical school. And finally got that all those classes done. I had a little more of a goal, and so my grades went up significantly because I actually had a goal to finish those off.
And from California, you went to Wisconsin?
Yes.
Okay.
Yeah, that's where I got into medical school at the Medical College of Wisconsin, Marquette University, and went to medical school there, and also did my residency at that level 1 trauma center, which was just a blast. We got to, it was a 4-year program, and 3 of the 4 years, I was also on the helicopter, and that was kind of a fun thing to do.
So you were actually a flight nurse?
Well, as a flight physician.
Okay.
So yeah, we had a nurse and a physician on the helicopter, and so we were basically a flying ICU that would go to scene calls, major trauma scene calls, or transporting very sick patients from one hospital to the other.
And how long did you do it as a flight physician?
I was there for 3 years.
Do you miss it?
I do kind of miss that part of it.
Well, we have Apollo here in Amarillo.
Well, they don't have physicians on the
No,
flights.
they just have nurses. Maybe you could get your foot in the door and get that started.
Well, yeah, that would be fun, actually.
What was your dissertation coming out of medical school?
I'm not sure exactly what you mean.
The dissertation that you had to do before you got your actual
Well,
diploma.
actually, for medicine, there's no dissertation. You do some research,
Right.
But there's no dissertation that you have ending up out of medical school. So you don't have a dissertation to perform.
Okay.
You basically go through medical school. At the end of medical school, you graduate, and then you apply for a residency program. In the residency, there might be some things that you focus on. For instance, I focused on EMS, which is and also I focused on the ultrasound, use of ultrasound in medicine.
Now you're certified in emergency medicine,
That's
correct?
correct.
Okay. Tell the listeners out there the difference between just medicine and emergency medicine.
It's a couple ways to describe it. Some people describe it as the most fascinating first 15 minutes of every specialty. Some people say it that way, but really that's kind of tongue in cheek. But I think a good way to describe emergency medicine is we are resuscitation experts, and we take any patient coming in, and we try to resuscitate them and improve their medical standing until we can get them to a specialty that takes over from there.
So naturally, you practiced on the dummies.
On the what?
On the dummy.
On the dummy?
The half body dummy.
Oh, yeah. Yeah.
Doing the CPR and all that.
Yes, sir.
Okay. What brought you to Amarillo?
Well, I've been practicing. After I got out of Wisconsin, I moved to Oregon. I was there for 12 years.
Mm-hmm.
Loved it. It was beautiful there and good people there. And then Oregon had changed some laws where I didn't feel like I could practice there anymore. So I was going to quit medicine and actually buy a oyster farm. And
what now?
An oyster farm.
Really?
Yeah.
Okay.
I was just so disenchanted with medicine. And so had done that. And then a good friend of mine, Gene McColgan, he was a partner of mine. He said, you might want to try out Amarillo. He was a family practice doctor in Delhart before he moved to Tillamook. So he suggested coming out here and checking this out in medicine before I just hang up medicine altogether. So I came out here and we loved the place and the people, just salt of the earth people here. So we decided to stay here. And so I've been here 13 years practicing emergency medicine.
Did you ever work at the main NWTH hospital?
No, I didn't work at Northwest Maine. I did work at BSA, the Maine at BSA, which was a really busy place.
Yes, it is.
So I practiced there for several years, and then we decided there were 3 or 4 of us who decided we wanted to do something different. So we decided to start a freestanding emergency medicine place in Amarillo, and we were the first ones to do it. And that was called ER Now. And then we built these 2 of them here in Amarillo and did that for a while until we sold them.
So you're currently one of the ER physicians at, you call these a freestanding clinic. I call them a little emergency clinic.
Yeah.
At I-40 and Eastern.
Yes, I'm available to work at 4 places, and I usually work either at Tascosa or Eastern.
And you enjoy this better than working at a full-blown Northwest hospital?
Yeah, I used to work in a really busy level 1 trauma center. Did that for a while, and I was an adrenaline junkie like the rest of the young guys. And as I was getting older, I was getting more and more tired of doing that, and it just wears on you. So to keep my longevity in medicine, I decided to kind of slow down a bit and go to the freestanding. Sometimes those get busy too, but I really enjoy the mix of patients that come in for that.
I know there's a lot of things uh, that you can't talk about because of confidentiality between patients and doctors. But in your medical career, it doesn't necessarily have to be at a freestanding clinic. Tell us, and I know that doctors are supposed to be neutral in their feelings. You know, my wife is an LVN. You can't let things get to you. But what is some of the most, I guess I could start off asking you the most enjoyable time that you've had as a physician, and then we'll go into probably some of the worst stuff that you've had to deal with.
Sure. Well, the most enjoyable time that I've had is right now. I've just enjoyed, and I think it has to do with the change in attitude also, because I was getting more and more tired of practicing medicine. But then I had a new, uh, I don't know, understanding of life and what it's all about.
Hmm.
And because of that, my attitude changed. And now I actually look forward to seeing patients and interacting with them and interacting with the nurses because of that change in my attitude. So now is the time where I'm really enjoying what I'm doing.
What is some of the worst things that you've had to deal with in the ER?
Mostly it's emotional. The drug problems that come in, the psychiatric problems that come in, they're very tough to deal with those issues, and you have to maintain your professionalism and empathy. And sometimes it's hard to dig deep and find empathy for some people that come in because they are so angry at life, and the way they deal with it is through drugs or alcohol. And then when they come into the emergency department, that's at a there it's a full blown anger fest. And so we have to learn to be able to calm that down a bit, be able to take care of people and to care for them and truly care for them. And I find that when I do that, they see that happening, and a lot of times they'll stop what they're doing and they're very appreciative.
During medical school, did you take any special courses to deal with problems like that in the ER?
Yes, actually, I was very fortunate at Medical College of Wisconsin. We had actually 4 years of uh, s- psychiatric care. So it wasn't just a month's worth of psychiatric care. We actually spent every year, at least part of our time, in a psychiatric hospital taking care of patients there. So I had a pretty good understanding of what to expect and maybe how to deal with those things.
Have you ever delivered any babies?
Oh, yeah. Yeah. Um,
Times have really changed with that, especially with insurance that I've read. A lot of doctors have gotten out of that because the insurance rates are so high. Tell us a little bit about that.
well, my very first rotation in medical school, my third year, my very first rotation was OBGYN. And I had a guy by the name of Jack Klieger, 83 years old, still practicing medicine. He was my instructor.
That's impressive.
Yes, and he scared the bejiggins out of you. He was old school. So
Right.
we'd all be standing at attention. We'd all be standing in a line at attention. He'd walk him up and down that line, put his bony finger in your chest, and ask you a bunch of questions. If you didn't know right away, he would just uh, ostracize you to your his saying was, interns are like Persian rugs. Every day you walk all over them, and once a week you take them out and beat them. So he was
I've
that
never
was
heard
the
it
old
put
school.
like that.
Yeah.
Okay.
But I learned a lot. He really did care and hoped that he could teach you something, and he did. He was an excellent teacher, and that was my very first clinical experience was OBGYN. And we were at a hospital where it was kind of one of the hospitals that was a uh, delivering machine. So we had, 300 births a month at that facility. So I got a lot of practice of doing that. Not that I was going to do that for a living, but actually,
That's a specialty area, isn't it?
yes, yeah,
Okay.
OBGYN is a specialty area, but I had to know something about that. In medicine, in your third and fourth year of medical school, you do clinicals where you're doing all types of specialties and learning about each one of them, so you have a good round educational background before you get into your specialty.
What was the hardest part that you can recollect going through medical school for you?
The hardest part was trying to find somewhere to get some sleep. I had
Yeah, doctors don't sleep much, do they?
and I had at the time I was married and I had a child, and so you had to kind of work at spending time with your family and split that up with with reading, and then also going and doing rounds and taking care of patients. So it was very difficult for me, and that was a source of angst for me, is making sure that I split myself up between those things accordingly. It was hard.
When you're a physician in an emergency room at a major hospital, you're on call 24 hours a day, correct?
In the emergency department, that's open 24 hours a day. Now, luckily, emergency medicine is kind of unique in the fact that we kind of do shift work. So I'm on for 12 hours and then I'm off for 12 hours. And during that off time, I'm not on call. I don't have a phone. I mean, as far as being available. So it's a unique specialty that allows us to actually have downtime.
I guess you do have to turn your telephone off, or you can get some type of rest.
Right.
Uh, are you at any time did practicing surgery?
Well, we do minor type things. Although there are times like in a trauma center where you're going to be doing major things like a thoracotomy, or that's where you open up the chest and you're clamping off the aorta. So level 1 trauma center, you're doing some major things. We do intubations. We do things like if there's an abscess, you need to open it up. So there's minor things and there's some major things that occur, but most of the time, the surgeons take care of that part.
What would you say in your profession at this day and time that you see the most of coming in the freestanding clinic?
Right now, this time of year, it's going to be the viruses. So we're talking about influenza and COVID, RSV, and rhinovirus are the big four that we're seeing right now. So during this time of year, we get a huge influx of patients with that type of thing. And then your usuals on top of that, which would be abdominal pain, chest pain, shortness of breath. Those are the big ones that we see day in and day out.
This is around the clock.
Round the clock.
How would you tell people right now the best way you can to protect themselves as we go into the deep winter months?
Um, I think a good school of thought is just keeping yourself healthy so that when you do get the virus, you're going to be able to fight it off well. That includes washing your hands often, and eating well, getting good sleep, drinking lots of fluids. Those are the good uh, ways of taking care of yourself. Then avoiding maybe area, if you are more susceptible, avoiding areas where there's a high traffic of people that might be sneezing and coughing on you to give you the virus.
Well, this is one advantage I feel like that you have when I first met you working at the freestanding clinic is you don't have the influx of people there that you would up here on Coulter at the main hospital.
Right. That waiting room is a hotbed of passing things back and forth. Everybody that's coming in is sick, and they don't have the same sickness you do until you walk out of there. Then everybody has the same sicknesses because you've been sitting in a waiting room for hours, although there's things they do to help prevent that from occurring. First of all, they change over the air in the waiting room much more often. They try to hand out masks to help prevent a lot of transference of those viruses. But it's not a great place to hang out
And you also don't come into a freestanding clinic and use the Q word. Quiet.
yeah, you'll get some dirty looks if you say that.
I can imagine. So, let me ask you this: and how many years have you been a doctor?
Let's see, 26 years after residency. Of course, I've been a doctor longer than that. Another 4 years after that, so 30 years total.
So you've seen a lot of changes
I
in
have.
medicine.
Yes, I have.
Would you say that in the present time that you still have people that come into the emergency room that are drug seeking? And this is why a lot of people that need the pain medications that come in the ER are denied that.
I think that that's for at least from my experience, I see that dropping down quite a bit. I don't
We're
see
talking
as
about
many.
the D word,
Oh,
Demerol.
yeah, Demerol. Well, we don't use Demerol in the ER, so that makes it nice. We use other D words like Dilaudid. But if somebody needs pain, we give it to them, pain medication. It's hard to tell whether somebody's drug seeking or not. I used to try to I I used to try to err on the side of not giving. Now I err on the side of going ahead and giving them the medication for pain if it appears that they're having pain. But it's amazing how much how many alternatives we have other than like the opioid narcotics,
Right.
and they work really well. So we're starting with those, and we find people actually are appreciative of those medications being given rather than the narcotics.
Being a doctor for 30 plus years, what is your view of the healthcare system in this country?
Well, I think it's changed since I've started, and I watched also when my dad was practicing medicine. So I've had quite a few years of watching what happened to medicine over the past 60 years, really. Um,
What are
and
some of the biggest changes that you've seen in medicine over these years?
I think it's moving towards more of a corporate practice of medicine. It's moving away from individual relationships between physician and patient, and it's moving more into a relationship between physician and insurance company, physician and hospital, and the patient uh, somehow gets in there somewhere. And so it seems like the patient care uh, is there is a different relationship now than it was before, and I understand some of that has to do with um, insurance companies and how they want to reimburse, and so that makes it difficult on physicians if you want to make a decision to do a certain test. Not so much in the emergency department, but elsewhere,
Hmm.
they have to have pre-authorization and get permission from the insurance companies to be able to do things.
Have you ever been in private practice?
No.
Have you ever considered private practice?
I thought about that when I want to slow down and put my name on a shingle, but then I would probably not deal with insurance companies and actually just do just pure cash only
Well,
and
you
do
got
it
a
that way.
long way to go before that. I mean, you
Yeah.
look like you're in your 30s. So
Well,
tell us, what all does it take to become board certified?
you once you're done with medical school, then you apply to different residencies. You go through your residency and then you take a test at the end. It's a board certification test within that residency program. For instance, I did a 4-year residency in emergency medicine.
Okay.
So all of my instructors were emergency medicine physicians. There were certain aspects of the program that have to be in place where you're certain level of trauma care, those kind of things where you have good experiences. And then you sit for an exam, and it's an oral board exam and a written exam, both. And so,
Many, many questions.
yes. And then once you take that, and you pass, then you become board certified in that entity. I belong to the American Board of Emergency Medicine, and that's the main one that is in the United States. And so I took the boards.
Does this mean you get more money because you're board certified?
No, not really. I mean, I work alongside family physicians who we all get paid the same. But these family physicians that I work with, they've been experienced in emergency medicine too. They've been doing it for years, so they're good physicians too.
There's something out there, and an individual found out that I was going to have a physician, emergency room physician, on the podcast, and they wanted me to ask you this, and you may or may not. I think you know the answer to it. This is where a lot of people get confused when they come to the emergency room. You walk in there, there's 10,000 signs on the doors, the walls, and everything. And it talks about billing, that the hospital will bill you for certain things and the emergency room physician will bill you. Explain how this works to kind of alleviate some of this confusion to people.
Well, that's exactly what it is. There's a facility charge, and then there's also a professional charge.
You being the professional.
Okay. I'm the professional, and then the facility has to provide nursing staff. They have to provide all the medications that go there in the emergency department, all the radiology equipment, all that stuff. So there's a facility charge for that they provide a environment through which a professional works. The professionals being the nurses and the physicians. And
in Texas, you're also considered public servants.
Yeah.
So when, let's say that I come to Northwest Texas, freestanding clinic, let's say I've got the flu or whatever I've got, and you treat me and I leave, then you're relying on me out of pocket, or you're relying on my insurance to compensate you?
I don't rely on either one of those. As far as when somebody comes into the emergency department, we treat first and then we bill later. If someone can't pay us, then we provide care no matter what. It's not like we can turn anybody away.
So you're basically a good Samaritan in the sense of the word.
Well, I get paid for this. It's not like I don't get paid.
Well, I understand that.
Yeah. Good Samaritan. I would think a good Samaritan is somebody who does it for free. And I've done that before. I've been to different countries and provided medical care for all different types of places in the Middle East when there's a disaster or something like that. I belong to a group that does free care.
Were you part of UNICEF?
No, I'm part of. I was. Some of it was on my own, and some of it I did a lot of work with Medical Teams International, which is housed out of Houston, out of Seattle.
Mm-hmm.
And they would send me to, for instance, during the war, the Afghanistan war, they had displaced people that didn't have any medical care, so they sent me to provide medical care to the people displaced out of the cities.
Now, you had some military intervention, didn't you?
Well, I wasn't military. I was an NGO.
Okay.
And so I would provide medical care sent by Medical Teams International, for instance, to go to Afghanistan and provide care there. Or the next year I went to Iraq and provided medical care there, and actually did a teaching mission there.
That's a big difference over there, isn't it?
Oh, yeah. Yeah, definitely.
More disease, more famine, things of that nature.
Well, during war, that all is hand in hand with, because everybody's fighting, so nobody's growing anything. So then famine follows. And so does disease and pestilence, because these people are out of the city into the countryside using water that's not been treated and getting dysentery. And, it's a sad situation.
You've also got an interesting story to tell. We're at our halfway mark now here on the chat about the Armstrong limit. And I think a lot of people probably don't know what that is. And I'm going to let you just kind of have the mic and tell your story with this.
Okay. Well, I was practicing in Tillamook at the time, and my wife was watching our child, play soccer, and a man came up, sat next to her, who was the president of NSC, which is Near Space Corporation. And he asked her if I knew. He asked her, "Does your husband know anyone who has any experience on a helicopter?" Uh, and she said, "Well, yeah, he has. I've been on the helicopter for 3 years in Milwaukee as part of my training." So she said, "Well, he told her to have me call him." So I called him and I said, "What's this all about?" And he says, "Well, you have to come in, sign a bunch of papers before I can tell you anything." And of course, that piqued my interest. I'm thinking, what the heck is this all about?
Right.
So I went into the office and I said, "Okay, here's the paper. I signed them all." And he said, "Sorry about the cloak and dagger, but we're doing a project." This was in 2009. We're doing a project where we're going to send somebody up to the near space and have him jump out of a capsule and free fall towards Earth and break the record for highest jump and fastest free fall, those kind of things. And that piqued my interest. I kind of like adventure. So I went ahead and said yes. And that was the Red Bull jump that happened in 2012, where Felix Baumgartner went up to 128,000 feet and jumped out of a space capsule, a perfectly good space capsule, and free fell towards Earth, breaking the sound barrier with his body and breaking records for the highest jump also.
You said he reached speed 1.2 Mach.
You're right. He hit Mach 1.2 on the same day that the record was broken with a jet plane by now I'm going blank on his name. Who had the record for the
his name's on the tip of my tongue. I can't call it. Quit thinking about it; it'll come to you.
Yeah.
That's what we used to always say.
Anyway, so he broke the sound barrier with his body, and I was there to basically, if anything,
on the ground.
Well, I was in a helicopter in the shadow of the balloon because the balloon's moving about 100 miles an hour from west to east because of the jet stream. You're way up there, you're moving fast. So I'm underneath him, and then when he jumps out of the space capsule, then I met him on the ground, landing the helicopter, and then I jump out with my jump bag and make sure everything was okay. And then, that was.
And this man was in okay shape.
He was in phenomenal shape.
Explain to the folks what the Armstrong limit is.
Yeah, the Armstrong.
And what kind of effect it has on the body if you're not pressurized.
That was one of the worries we had, many worries, but one of them was a thing called embolism, which is when you reach Armstrong's line, which you're referring to, 63,000 feet, I believe it is, you get up high enough where the boiling point, the pressure is so low that the boiling point of water is 98.6, i.e. your own temperature can boil you. So that means that you start boiling at that line.
Literally, spit can boil in your mouth.
Yeah, yes. Your eyeballs boil, the surfactant in your lungs boil, and so we have spacesuits to give counter pressure to prevent that. Well, Joe Kittinger, who had the record before, he lost pressure in his pressure suit. Luckily, his hands swelled up so much that it stopped the loss of pressure, but his hand blew up, and his hand had embolism. And
so he literally sealed the suit
he sealed the suit with the swelling of his hand from boiling. And so,
and he survived this.
Oh yes, yeah. In fact, he was one of the ones on the project. He helped us break his own record.
So what happened to his hand?
It reverted back to normal after he got down to pressure.
You also had mentioned something about Mount. You climbed Denali?
Oh, you mean you talking about Mount Rainier?
Maybe I've got the name wrong here. Yeah, you climbed some mountain, or you were involved in some high altitude expedition?
Yeah, it was just that was during my youth. I actually was able to be a part of climbing up Rainier, which a lot of people have done. I got to actually climb it with a guy by the name of Ed Vistiers, who was the only man. He and Scott Fisher had climbed Everest without oxygen. They were one of the first Americans to do that. And so I got to meet him and spend time with him on the mountain.
And he actually climbed to the summit of Everett without supplemental oxygen.
That's correct. That's correct.
Can you explain to the listeners, for those of you that don't know about this, there's something up there called the death zone, where people have fallen from due to the lack of oxygen, and their bodies have just been there for decades and decades. They can't get to them. What actually happened to people that tried to climb that without the supplemental oxygen?
Sure.
What happened to the body at that point?
First of all, I'd like to clear up something about oxygen. At sea level, oxygen levels
Plentiful.
are 21%.
Okay.
Okay. At the top of Everest, the oxygen level is 21%. It's the same oxygen level, same number of percent. The problem that's changing is, once again, pressure. Pressure changes as you go from the lower part of Everest all the way up to the top. The PO2, we call that PO2 of the inspired oxygen, is much, much less. And so
It's
amount,
thinner.
You could call it thinner. Yep.
Yep.
And so the thin air is the thing that makes the problem, not so much the percentage of oxygen. It's the same oxygen. It's not lack of oxygen, other than the fact that the pressure of that 21% is much, much less. So your arteries don't get the oxygen diffusing into your bloodstream like you would at sea level. So that's a problem up that high. And so your oxygen level drops so low, your oxygen saturation, that you're now starving your brain and you're starving your heart and everything else of oxygen. And so the ways of trying to get around it is give extra oxygen so that you have more, like a higher concentration of oxygen. That's where people bring up oxygen tanks. Well, Ed Vistiers, he perfected a way of doing that without supplemental oxygen by increasing the pressure in his lungs by blowing out in a pressure against pursed lips to increase the pressure in his lungs, because you're breathing in 21%. Then what he does is he squeezes the pressure in his lungs to the point where the pressure goes up and there's more oxygen that goes into his.
So he's not breathing into a brown bag, so to speak.
No, that's all you're going to do is build up CO2 there.
Okay, right. So a lot of these people that went up there without the supplemental oxygen, they lost consciousness because of it.
Yes. And then they would just die along because of the fact that the brain's not getting any oxygen. Then they have a thing called high altitude cerebral edema and high altitude pulmonary edema. That's HACE and HAPE. And those are high altitude entities. We try to get away from that by taking certain steroids that kind of help prevent that. And you take a medication called Diamox, which also helps you breathe. It causes you to have a higher acid in your body that makes you breathe faster, and then you're actually taking in more oxygen. Those help with high altitude problems, but up that high, you're just not getting enough oxygen.
So this would be the same. And let's say that you go to Denver, Colorado, mile high up. 5,280 feet. People have to cook, say, cornbread differently than we would here in Amarillo.
Exactly, because the boiling point of that water is so much lower. It takes longer for the hot water, which is not as hot, to cook whatever it is. So you have to lengthen your time of cooking in order to compensate for that.
You learned all this in medical school?
No, I've I've always been interested in things like this. That was before medical school. It was just part of when I climbed Rainier. I learned all about high altitude sickness and those kind of things.
Tell us some other achievements that you've had, whether it be medically related or not.
Well, the biggest adventure I've had so far is recently, and that is uh, studying apologetics at home and taking classes in apologetics at uh, Biola University and things like that. Now, you're going to ask me, what is
That's what
apologetics?
I was just fixing
Yeah,
to do.
it's the study of saying I'm sorry. No, I'm not. I'm just kidding.
That's what I thought it was. You're studying how to
No,
apologize to
no,
people.
that's actually a Greek word that we use that means give a defense, and it has to do with belief in a God and the being able to give a defense for why you believe what you believe. And that's been such a great adventure for me now. So that's what I'm doing now, and that's what's made me change my attitude on taking care of patients, because now I think I feel like it everybody is imago Deo, which is the image. People are made in the image of God, and because of that, my attitude changes when somebody comes walking in the fact that he's not a low life, or he or she is not a low life. They are all image bearers, and they're made in the image of God, and because of that, my attitude totally changed on how I take care of patients.
Let me ask you something. The very first time that you saw me and we met, what was your perception?
For you,
Hmm.
that's a good question. Um,
Do we have time to take a commercial break on this?
When I first think of you, you I thought you were a medical person.
Really?
Yes, because you're well read,
Mhm.
and you started spouting off medical terminology to me, and I'm thinking, oh, this guy must be either a physician or someone who knows something. Then later on, you said, "Well, I read a lot," and I thought, okay, that makes sense.
Yeah.
That you are well versed in many things.
I am well versed in hereditary angioedema because my
Yeah,
wife suffers from that, and that is a confusion between. And you being a doctor, you know this. There's a difference between regular angioedema and
correct,
hereditary.
correct.
And if you want to learn something about HAE, ask me because I have really had to learn a lot of it. I have been in a lot of emergency rooms when my wife has had these attacks, and the doctors have come up to me. I'll tell you a true story right quick. We were at UT Southwestern in Dallas. We were coming back from Northern California, visiting the redwood trees, and she had a bad attack. She showed you that picture on her cell phone, and when I got into the ER at that hospital, the doctor came out and said, "What is this? What do I do?" He had no idea. And we all went in, and some of the nurses, and there was another doctor in there. He asked me, he said, "How can you be so calm at a time like this?" I said, "Because if I lose it, I can't tell you what to do." And I'm sure you have studied HAE. It is a very, very, it's a bad thing to have,
Very
truly.
debilitating. Yes, yes,
Debilitating. That's the word I'm looking
yeah.
for. So, but no, I am not an MD. I read a lot, and I thank you for thinking that I was a physician, but I'm not. But as a physician, I want to ask you something. Then I'm going to get on into our final question here for you because I know it's going to take you a while to answer this. But what is the deal? You've been a 30 plus year physician. What is the deal with doctors and chicken scratch handwriting? What's up with this?
There's a class in medical school. It's
Is there
teaching.
really?
No, I'm just kidding.
No.
I think we're
It's
in such
Greek.
a hurry.
It's Greek.
Yeah, we're in such a hurry to get to the next thing that we don't take time to. It deteriorates our handwriting to the point where it's illegible. Nowadays, that's not an issue because we use computers for everything. So, and I dictate into a computer, so it basically types it out whatever I need
Have
to do.
you ever had a pharmacist call you on the phone and say, "What in the hell did you just write on here?"
Well, nowadays my prescription pad those are all typed out too, so it makes it less of a problem unless you're going to handwrite something, and then I take time to actually handwrite it well.
What advice, and we've got about 10, 12 minutes left. What is your advice Dr. Turney, to tell anyone that is wanting to become a doctor? What is your advice to them at this point? Because this country needs more medical professionals. We have a shortage.
I think check your pride at the door.
Check your pride.
Pride at the door.
Explain that.
Well, if you're going into medicine to increase your prestige or that kind of thing, if that's what's driving you, I would say you need to rethink that. If you're going into medicine for the money, I'd also ask you to rethink that.
Most doctors are not as rich as people think they are, correct?
No, but we make good money. But you're right. If I was going to go make a lot of money, I'd go into business. But medicine it's changing. But my hope is that if we get the individuals who really do want to care for people, then that the medical community will then change and continue to put the patient first.
Would you say that someone really has to be born with the willingness to care for people in emergency rooms and
No,
hospitals?
it's a learned. It's a learned
behavior.
Behavior.
Okay.
And even people who have had a change in their lives where they finally understood what life is all about, they can be really good physicians. So that's what I would say about that. So,
how many years does it take to be a doctor now?
Well, it's 4 years of medical school, and then if you want to do a residency, if you like family medicine, is 3 more years. So 7 years total just in medicine, but then you also have to have a college degree. So there's 4 years there. So 7 plus 4, around there.
Now, you said that you had
12.
started in OBGYN. Now, that's a specialist range. How many extra years would you have had to go to become a gynecologist?
I think it's 4 or 5 years.
So you spent about half your natural life in college.
I took the long way around the barn. So I started college in 1979 and I finished in 2000. So that's 21 years that I was in college doing various things, but I was a firefighter and then I became a nurse and then I became a physician. So I took the long way around.
Did you think it would ever end?
While you're in it, no, you're
Right.
just, it's like, this is lasting forever. I found the key, though. It was given to me by my father, and that is, he came up to me, and I was just really frustrated with life because I'd been in school for so long. And he said, Matt, just remember, don't stop living while you're going to school, because I'd put everything off. And so once I realized that, then it made life much, much easier while going to school.
Is medical school as expensive as people say it is?
It can be. If you're going to a private school like I did, it was very expensive. I had two house payments. One was for my house, and the other one was for paying off my medical school. So, and so it was. Some people said you just went into medicine for the money, and I worked out financially where I would be if I stayed as a nurse to where if I went into medical school and then it worked as a physician, and I broke even this year medically.
Is that right?
Yeah. So the even break is 6. I was 65. I'm 65. So
you don't look it.
This year is my break even point.
Okay. Is your wife a nurse, a doctor?
She's a nurse.
Okay.
She was a pediatric nurse, and she worked at the Children's Hospital of Wisconsin when we were in Wisconsin. And she went to the hematology oncology transplant portion of that. So she was working with kids with cancer and doing the bone marrow transplants for these kids.
Oh, wow.
Became the transplant coordinator for the hospital. And so she got the responsibility of finding the matches for the bone marrow and then going and getting them, sometimes having to go out to Europe to pick up bone marrow that would match the child who needed a bone marrow transplant. So it was very fulfilling for her, but it was also tiring.
Do you have any children that has followed in Daddy's footsteps?
My daughter has somewhat. She actually works at Northwest now. She is a speech pathologist at
Okay.
Northwest. So she gets to take care of all kinds of. She was doing some infant work when she was in Dallas, where she practiced, and then she just recently moved here to Amarillo, and now is practicing at Northwest as a speech pathologist.
Is her plans to become a doctor?
No, I think she's good where she's at. I think
Okay.
she just wants to settle in on what she's doing now. So,
What about any grandchildren? Have they fallen into the medical profession?
well, they're all so young. I have 9 grandkids, all of them under the age of 11. So, uh, I haven't. I haven't.
By the time they become a doctor, we'll all be gone.
We started life a little bit late on kids, and so we have grandkids that are young. So,
And you're 65 years old.
yes, sir.
You don't look it. You look
Oh.
like you're in your early 50s.
Oh, thank you.
A doctor that takes care of himself. We've got about 10 minutes left. What would you like to add to this podcast?
Well, I've never been in a podcast before, so this is quite interesting. I guess advice to the listeners from an old geezer who has done a few things, and that is live life to its fullest. And I guess
Quit smoking.
quit smoking. Yes, quit smoking like you have. Amazing. That's awesome.
I smoked for 32 years. And I got on a prescription that I'm sure you've heard of. It's called Chantix.
Mm-hmm.
And I took one pill. And I haven't had a cigarette. This upcoming May will be 11 years.
That's awesome.
It broke the habit of going up
Sure.
and down with your arm. And at the cost of cigarettes these days, I would recommend anybody quit.
Right. So, yeah, the advice of taking care of yourself, taking care of others, think of others too. In this day and age, it seems like we're many times thinking of ourselves, and we don't tend to reach out to others who maybe even disagree with your lifestyle or your worldview. But my advice would be,
Those are generally called haters. And I don't pay any attention to them.
Well, I think that if we try to listen to others and listen to arguments in life, then I think that we're at least on our way of moving toward a better relationship within our communities. So I would say live life to its fullest. I've had a wonderful life. I've been very blessed in that, and but I went to seek it out, and
Right.
so it was seeking it out that I got to do a lot of fun things.
How many more years you think you'll stay in practice?
Till I can't.
Any plans for retirement? Are you a fisherman? Or are you a hunter? Or are you a troublemaker? Or
yes. I would practice. I probably would cut down on the amount of practice. I have a boat in Maine that I do sailing on, so
I have never been to Maine.
Sail. Oh, beautiful place!
I've been all over New England, but I've never been to the state of Maine.
It's a gorgeous place. And then just spend time with family and enjoy life.
So no plans for retirement yet?
No, because I have too much fun doing it. I really enjoy it.
You know, you've been a doctor for 30 plus years. How do you think you're going to cope when you decide to give this up? And you're sitting in your living room one morning drinking coffee or something, and 4 walls begin to cave in on you.
I'll never do that because I'll be teaching. I also taught high school for 2 years, just the last 2 years. I didn't do it this year, but 2 years ago, I taught high school biology and apologetics to the high school. So I did that for 2 years. Is that
right?
Yeah.
Which high school were you at?
It was the Oaks. It's a private school, and I just thoroughly enjoyed, loved the kids, and I spent time with that. So I would probably go back to teaching full time, probably for free, just to enjoy life and enjoy kids.
So you have your plan, by what I'm hearing, is you're going to work to your
Till I can't.
6 foot under.
Yeah.
Well,
And I'm going to stay in good
never
shape.
give up.
Exactly.
Yeah.
Well, I want to be able to have some type of impact on the world as far as in my small community, but be able to share with others maybe a lifestyle that they can benefit from. So that is something that I really look forward
I
to.
think that's wonderful that you want to pass some of your knowledge as a physician and other things that you've done in life on to other people. Because you got to remember, kids out there. That's our new generation.
Exactly. And I find that that's probably the largest impact I could have on community is work with kids and show them a world that they could make for themselves in a very positive way.
One final question before we go. When you do plan to retire out of medicine, I know a lot of people let it go as far as their license, but do you intend to keep your license active just in case you decide, you know what, I want to go back into this?
No, I
Because
look at
once you let it go, it's it. You've got to start over.
Sure. My father retired at the age of 72, and he would always ask, "Hey, Matt, you know what today is?" And I'd say, "No." He says, "It's Saturday." And every day he would say that. So I guess he eventually hung up medicine and just he let it go all. He says, either I've got to let it go altogether, or I have to keep my hand in it, not just keep the license. The license is nothing magical as far as that's concerned. If you're
That's
not
true.
practicing, you keep that license and then you try to go back, you're going to lose some stuff. And I don't want to put that on any other patient that I want to stay either up on it or done. And so I would, if I retire, that's it. Hang everything up.
One final question for you. Are you a Green Bay Packers fan because you're
I
from
am a
Wisconsin?
Green Bay Packers fan.
Are you a Green Bay
Through
Packers?
and through.
Well,
You
they're not
betcha.
going to the Super Bowl
No.
this year. So, well, Dr. Turney, it has been a pleasure to have you on the podcast, and hopefully we may run across each other at a later date in time when you have let it go and you're a teacher or whatever you want to do, and get you back on here again and let you talk about that.
Well, thank you for having me on. I really appreciate it.
Very welcome. And folks, with that being said, that will wrap up this Friday weekly edition of the podcast. We will be back next Friday with yet another edition. Visit our YouTube channel. That's youtube.com/ at Alan Fitz Podcasting. And on Monday, we'll have the new topics set for the next show. Until then, this is Alan Fitz. As always, have a great weekend, and bye for now.